So I'm hoping to talk about how to understand these reports, how to give relevant advice to our clients, and how do we apply whatever we see to our body composition program. So that is the gist of my talk. So for the CRT over here, you all know that the body is made of fat, water, muscle, bone, and various other things like the organs. And part of it, like the organ size, is not really going to change. The other things are variable. So how do we measure it? What we do here is known as bioelectrical impedance analysis. So we hold those electrodes, and then the embody 270 gives us some kind of a analysis. There are various other methods, and each of them comes with their own set of errors. So there is the most standard, which is the DEXA scan, that is the dual energy X-ray absorptiometry. And then there are even more precise ones where, submersion techniques are used, air displacement is used. But even what we do, depending on the machine we're using, has around 3 to 8%. In fact, the machines that we chose have around 97% accuracy. That means 3% error only. Now, why am I talking about all these things? I apologize for the small font over there. You don't have to read it, don't worry about that. So what happens is, these days, Healthify Me and CultFit are selling these contraptions for 2,200, 2,500 and all. So I want you all to understand that the machines we have are 4.5 lakhs each. And so you obviously can't have cheap and best. You cannot compare a 2.2 thousand with a 4.5 lakh machine. So if your patients are talking about that, now VLCC had something which was around 75,000 or so. They had something called Tanita. So please be proud of what we have. Now, why in-body? Why spend this much money? Because it has a 8-point electrode, 2 in each palm, 2 in each foot. So totally they're using 8 electrodes. And a lot of machines, what they do is, either they'll measure upper body or they'll measure lower body, and then they will kind of extrapolate using an equation to the rest. Whereas here, you have direct segmental measurements. And then you have multiple frequencies which are used, because different tissues respond best to detection at different frequencies, and there are no empirical estimations. So what we are using is an excellent technology, and when we bought it, we did not have all these body contouring business in mind. We bought it just because our patients had to become healthier just because they have crossed our doorstep. So that was the reason we bought it. Now, for those of you, particularly CRT, who are thinking that 25 BMI is still acceptable, yeah, it could be acceptable. We are not into body shaming, but 23 is the cutoff. And they say that if a woman has a waist circumference of more than 29 inches, then she should start doing she should start making active efforts to prevent gain of weight and to start exercising. And when the waist circumference crosses 31.5 inches, then you are supposed to take medical advice. 31.5 inches for women warrants medical advice. And sadly, most doctors, if you go to a random doctor of any specialty, you tell them, I've come to you because my waist circumference is 32 inches, then they'll say, mine is much more. You forget it, that kind of a thing. You know how it works. So thanks to Mrinal, we can do better than that. So the normal BMI for Asian Indians is 18.5 to 23. Overweight is between 23 to 30, then grade 1 obesity, grade 2, and then grade 3 or morbid obesity. So now the insurance coverage is available for bariatric surgery, and now the cutoffs for bariatric surgery have been revised. So 32 BMI with comorbidities, including insulin resistance and PCOS, or 38 BMI without any comorbidities will get them insurance coverage. So if you have a patient who is in that category, please do motivate them. You will get good karma. So BMI is something that a lot of people understand. But the problem is that BMI being equal does not mean that all of us are equally healthy or equally unhealthy. So we at Oliva actually have gone way beyond that more than a decade ago. So we all understand this term called, at least the doctors do, the dermatologists do. For the lay people, we call it skinny fat. For our core team of doctors, we call it metabolic obesity or sarcopenic obesity. So skinny fat is on the rise, if not overt fat. So the way we look at fat is anthropometric obesity or metabolic obesity, and very rarely a healthy individual. So that's been my personal experience, and I'm sure yours is similar as well. So whenever we do BCA, generally do we see normal BCA ever? Rarely, I guess. But so for the CRT here, look at these two women. They look kind of similar in shape, size. But if you look at the cross-section of their abdominal wall, the one over here has very thick muscle and less fat, and the one over here has a lot of fat. So if you look at BMI, both the BMIs are normal, they're equal, but the fat percentage is different, which is why we bought our first body composition analyzer way back. And we had it since the time we founded our first clinic. Even when Banjara started and Kukatpalli started, we started with a body composition analyzer. Now, for a lot of us, fat is a cosmetic concern, isn't it? But now we are beginning to understand that it is a serious health concern, because fat and adipose tissue are now considered biologically active endocrine and paracrine organs. That means fat produces inflammatory mediators, it manufactures hormones, and it metabolizes hormones. So we know that generally after a certain age, we cannot increase the number of fat cells except in size. The number stays more or less the same except in rare situations. And what causes fat to become a disease? I'll talk about that. But before that, I'll share one story of these two gentlemen here. So these two gentlemen had an equal BMI of 22.3. And we know that 23 is the cutoff, so both are normal in terms of BMI. Over here is a Eastern European endocrinologist, and over here is our own neighbor from Pune, both endocrinologists. And they met during a fellowship, and then they co-wrote this paper. It's an old paper published in Lancet, and they found that the two authors shared a near identical BMI. And this was a DEXA study that was shown. I didn't include those pictures here, but the similarity ends at the level of the BMI. The second author, that is the European, runs marathons, whereas the first author's main exercise, something that's very familiar to most of us during medical school days, is running to beat the closing doors of the elevator in the hospital. Now, I have done more than my share of those. I'm sure a few of you have done that as well. So why is it that these two people have normal BMI, but one is super healthy and the other is unhealthy? The Eastern European had a percentage body fat of 9%, whereas our Indian from Pune had over 34%. So one, we are genetically prone to being obese. We were during the process of evolution deprived of a lot of food, which is why when we get food, we tend to store it, and we tend to store it in the viscera and in the abdomen, which means that we have to work much harder than our Caucasian counterparts to stay healthy, which is why most of us would not see people with BMI 60 and 70. We do not have 150, 200 kg people in India where they have to be lifted with cranes, because we would die much before we reach that stage. My best friend, who's a nephrologist in Florida, keeps cribbing about how her patient had to be airlifted and doors had to be broken and ceilings had to be gone through so that this obese a person who could not fit through his door was brought to the hospital. Now, before we fail to fit through the door, we will go straight up, I think. Which probably is not a very bad thing, but intrauterine undernutrition is one factor. Now, this is my own body composition analysis. That was when, I can't even see it properly, but 22.1 I think is the BMI at that point of time, and the percentage body fat was 38.4. Now I'm heavier, my BMI has become some 23.2 or something, but my percentage body fat is lesser. So I'm heavier, but I'm healthier now, because that was a time when I was not exercising as much. So BMI is something that gives you an overall thing, but what else is better? So if you have access to something like an InBody, then use it and analyze it. If you don't, then just take an inch tape and measure the waist circumference, and that will give you an inkling of at least the subcutaneous fat, if not the visceral fat. Even in InBody, there are cheaper variants than the 4.5 lakh thing that we bought, but they were not showing the visceral fat, which is why we did not buy that. So this is a slide that Dr. Rekha has shown, and insulin resistance is something that most of our doctors understand well enough. For the others, the non-doctors here, please understand that what we are doing is great service to our clients. We are making them aware. We are doing something called primary prevention, so that when they get older, or if they are already older, their risk of death due to cardiac disease and to stroke is much less, because they took the good decision of walking into Oliva. So that's how we see it. So of course we know that India is world capital of diabetes. India is not yet the world's obesity capital, but soon we are going to get there. And childhood obesity, India stands second in the world. So chronic inflammation is the problem, and the way we look at it nowadays is that the amount of fat is one thing, but when fat is compressed into a small area, because when your height is a particular thing and you have more fat than you should, then there is going to be hypoxia, there's going to be cell death, and then there are going to be these kind of chemicals produced which are called exosomes. So we look at it as two kinds. We look at it as fat mass disease. You have excess fat, but then also sick fat disease, which is unhealthy fat. So excess fat is anthropometric obesity. Sick fat is anthropometric and both metabolic obesity. So I thought I wanted to share this kind of a gyan with you, because I don't know how many of you keep reading this kind of stuff. So fat inflammation is an important thing. Now going on to a body composition analysis. So this is a kind of sheet that we keep seeing. So what are we looking at? We are looking at the BMI. We are also, I'll tell you what I look at, because obviously I have as little time as you do during your working hours when I have to give my analysis to my client. So then I look at the percentage body fat. And I remember that now, am I going to refer to the normal values every time? Obviously not, because I've been doing this job for long enough, and so have many of you. So we need you to get into that mode that a particular number strikes a bell. So for women, for Indian women, the ideal percentage body fat is 28% or less, and for Indian men it is 20% or less. So most of us, if you take an average percentage body fat of this room, it would be around 35% plus for sure, if not 40%. So just to give you a perspective, percentage body fat, then the next thing we look at is visceral fat. So they say that if the visceral fat area is more than 100 centimeters square, then you are going to get into a high risk zone for cardiac disease and for cerebrovascular accidents. So then you look at the target of the fat control and the muscle control. So look at the BMI, the percentage body fat, and look at visceral fat. 5 things that I look at: fat control and muscle control, because I have less than a minute to assimilate this and to give whatever advice I need to give. And it's not really easy if you're not used to it. So what 97% and all we've spoken about. So I'll give you some quick pointers. Now, do I focus on water and all that? Not really. So this is an easy way of understanding if somebody is got excess fat. If the curve is like a C, the weight, skeletal muscle mass and the body fat mass are all in a line. So if you have a C, it means that fat is excess and muscle is deficient. And most of the ideal clients for body contouring fall under this. So irrespective of their BMI, even if their BMI is normal, but you see a C curve, then you know that they have excess fat which can be targeted by machines and by lifestyle. Whereas the ideal one is something like a I shape. So I shape means that your weight, your skeletal muscle, your body fat, all are normal. And this D shape is somebody who's very muscular. The weight is okay or maybe excess in terms of BMI. The percentage body fat is low and the skeletal muscle mass is high. So these are the people where we probably might not be able to help with our fat reducing devices, but we might be able to help in body contouring because they have a sag. So if somebody loses weight when they are young, and all those of you who are young and who have weight to lose, I would say do it now, because your skin and your connective tissue has elasticity to spring back. Whereas if you're on the wrong side of 35, especially after 40, the way it shrinks is not going to be ideal. So there you have these ideal clients for pure sag. So this kind of a client who has a body fat which is low is not going to need a ultrasound for fat breakage, but he is going to need preheating with your RF and then a skin sag protocol. And I hope all of you are able to follow whatever I am saying. So BMI and percentage body fat. This is normal BMI, excess body fat. So we call it metabolic obesity. Here you have high BMI and high fat. Easy enough. And then here you have high BMI but low body fat. That means this person is muscular. So good for him or her. But if they lost their weight and they became fit later on in life, you might want to talk to them about skin sag. So you don't have to talk to them. You just need to have one or two standees and then people who are aware of this. So for females, any percentage body fat which is less than 18 is not good. So you must have heard of athletes, women who have low fertility. So we don't want to go so low, but very few of our clients are going to go that low anyway. Most of the time it is excess that we are worried about. So this is one more beautiful part of the analysis. It actually tells you where the weight is distributed, where the fat is distributed. So this could be one thing that you might want to talk about when you're doing a body composition analysis for a BC client or a BC potential client. But if you're just doing this for someone who's got acanthosis nigricans or hirsutism or PCOS, then you might not really want to focus on the arms and the legs. You just want to, I do tell my patients that, typically most of us don't have enough muscle in the lower body. So I tell them that when you're doing your strength training, please focus on your legs, because most of us are doing upper body exercises. So this does help. And then this is a score where 100 is a perfect score and super healthy people can have above 100 also. But if 75 is there, you know that it is ideal. So most of us are in our 60s over here and we know how far we would like to go. So the target weight is something that is mentioned in most of these machines, and it also gives you weight control, fat control, muscle control. This is very important, and this is something that we do whenever we do, at least the nutritionists do when we are assessing someone for body contouring, that they could have lost the weight, but did the weight loss come from muscle or fat? So this concept somehow very few people have. So a lot of people, when they start going to the gym, they put on a little weight and then they get upset. But when you show them that whatever weight you've gained is actually more muscle, your fat is either reduced or stayed the same, then they obviously feel better. So please be very hands-on in terms of these kind of things. Then of course the visceral fat level and the waist hip ratio, this is a gender determined thing. And one of the common mistakes that I have seen during my own experience is that the therapist puts in the wrong gender, then everything is going to be wrong. Or therapist puts in the wrong height, then the whole thing is gone for a toss. Wrong age, again disaster. So please make sure before you give your gyan to cross-check those kind of things. Otherwise you end up looking a little silly. So obviously for women, you want the waist to be smaller. Men can get away with a higher waist hip ratio of 0.8 to 0.9. So BMR is something that you could look at. Generally, we don't spend a lot of time on this. So there will be some people who say that, I don't have a good metabolism. I'm not able to, I eat very little. Most of our clients are hardly eating. And of course, they are not losing weight. This is something you hear a lot, right? And most of them go walking. So I have to tell you this. So I've been working out on and off rather regularly with a trainer called Ravi, who's also in charge of the exercise part of Oliva's entire body contouring and beyond weight loss programs. So, and my personal weakness is that I cannot exercise alone. So if I have to go for a run, Ravi has to come with me on his bike. So one of those days, early, and we used to work out between 5 and 6 a.m. Nowadays, I've made it 6:30 to 7:30. So this was pre-COVID days. So one day I was kind of dragging my feet and pretending to be running. And I saw this bunch of ladies very happily chatting, and they were walking towards us. Then I asked Ravi, what do you think of this? And he said that if it were your mom, my mom, who is now 75, that time she must have been 72, 71, then that kind of exercise is okay for her. But for you, that won't do, he said. So the reason being that if I am going to walk even for 20 kilometers, my heart rate is not going to go anywhere near the target. Whereas if my mom does that, then her target heart rate is much lesser, and there something will happen. So my iWatch, it's quite smart actually, does not recognize the walks I do with my dog. I have a dog named Laser, for those of you who joined after Laser grew up. And whenever I tell my trainer that, I have to go home and take Laser for a walk, the first time she got very shocked. She thought I was actually going to take my Laser's machines for a walk. So my iWatch doesn't recognize this as exercise, but sometimes if I forget to switch on the exercise app, but I'm jogging on the treadmill, it says, "Are you exercising?" So that is because the artificial intelligence is designed to understand the target heart rate and exercise are related, whereas most human beings that we talk to have not understood that concept. Agreed? So basal metabolic rate, you might want to talk about it if somebody is cribbing heavily about not losing weight and all, but mostly our nutritionists will do that job. So we will do a little bit of analysis. 20.6. Okay, BMI 20.6. So BMI 20.6 means, let's ask the CRT what they think of this. Would you want to put her in a BWL or a BC? Now this lady says that she is not happy with the fat she has. So would you want to say any volunteer from the front desk department? No volunteers? Then we'll have to pick names. So normal BMI, but fat percentage is 41%. So any thoughts? What would you call her? Would you call her normal? Would you call her obese? Not a single person. Obviously, the doctors want to give you all a chance. So let's ask the nutritionist, smaller group, what would you call this? So this is metabolic obesity. Now, can Bindu help me with her target fat control? Minus 7.9 kg. This girl has to lose 7.9 kgs fat, and her muscle control? Plus 9.9. So that means this girl ideally should put on 3 kgs. She needs to, 2 kgs or so, she needs to lose 7 kgs fat and put on almost 10 kgs of muscle. So let's say this girl comes to one of you, she's a young girl, and her BMI is okay, but if she says, I have a bit of a muffin top, I'm not happy with this, because you can imagine that her, Bindu, can you read out what this says? Segmental fat analysis in the center on the abdomen, how much excess fat is there? So her abdominal fat is 205%. It is double of what should have been. So let's say if she comes to you, comes to any of the CRT and she says that, let's say she's an existing client, she's a young girl, and she says that, this is bothering me. She's a happy client of ours. We've treated her, let's say PCOS and her acne or whatever. Then what would you suggest? Would you say, no, your BMI is great, I wish I had that? Body contouring would be the right option. Thank you so much. So what would you do then? So you will arrange a meetup with the doctor. So what kind of a form would you make her fill before you take her to the doctor? So there is a body contouring profile form which you will make her fill, and then you're going to put her across to a dermatologist who will then obviously inspect the part. Now, how many of you, please tell me honestly, do a show of hands for me, please, actually inspect the part every time somebody says body contouring? I saw 4 prompt hands and then 2-3 hesitant hands. So that means there are a lot of people who are not inspecting that. Now, how many of you, if somebody says, my thighs are a concern, or let's say the kind CRT has said that, this client is interested in some thigh treatment, body contouring treatment, how many of you have actually undressed the client and then done this? How many of you would go to a procedure room and make them lie down and then do it? Because we don't have couches in our consultation rooms. So I have a feeling it is not enough people. So I'm sure some of you do it all the time. So if this kind of a situation comes, now she is a 27-year-old woman. So now we don't know whether she's had 2 children and then she's become very aware post-delivery and she's got a sag, or she's got some amount of only fat. She's an unmarried girl, she doesn't have a sag. 27, you don't need to have a sag. So you would want to understand. So once you inspect, you palpate, you don't have to percuss and auscultate, but you will have to make them do certain kinds of exercises. Like you might want to post-delivery, you might want to make them do a kind of upper body crunch so that you can feel the divarication. You want to feel the tone of the rectus. So use a glove, don't hesitate, palpate and do it. So this is how we would do it. And that is how we know the difference between fat and sag. Because if you just look at BCA, will you be able to understand? No, I would not be able to understand, and I don't think any of us would be able to understand. So now if we had someone who's very motivated, normal BMI, but she's got just a little stubborn pocket of fat and she's actually looking for a very quick result, I wouldn't mind referring her to my dear friend Dr. Kamal Bakhtiyar, who's visiting from Dhaka. He's spending a week with me, so I invited him along, and it seems he does 1 liposuction a day. So 1 liposuction a day in Dhaka he's doing. 1 body contouring client a week is what we are talking about. So just look at the perspective. So thank you so much for telling me that. That has given me great perspective, Dr. Kamal. So this 27-year-old metabolically obese individual, women, would be a great candidate for body contouring because she doesn't have too much of excess weight. She has just excess fat, which is very amenable to this. And also important, what's a visceral fat like? Sorry. Her visceral fat is normal. Now sometimes if you have a lot of visceral fat, our machines are not going to help. So you want to look at that as well. So now next one, Bindu exercise again. So this is a 17-year-old male with a BMI of 44.3, 51.3% body fat. Please write it down for me. BMI 44.3 and PBF 51.3. So how many of you want to refer him, this is a male, want to refer him to Dr. Kamal? Anybody? There, caught you, you people. This 44 BMI, 44. So beyond 35 itself is difficult. Beyond 38 is open bariatric surgery candidate. So if this person comes, then we don't have to deny him a beyond weight loss. Because before this person becomes eligible for bariatric surgery, he needs to show that he can lose 10% of his body fat. So 10% would be how much, Bindu? What is his weight? 100 something. 117. This guy is 117.7 kg. So before technically he becomes eligible for bariatric surgery, the nutritionist here should help him by making him lose 17 kgs. He needs to lose 50 kgs fat, it seems. So this is a bariatric situation. Then next one, Bindu. Now we have what male? 28-year-old male. Kadu, BMI. BMI is 27.6. Can you all write it down, please? 28-year-old male. BMI 27.6. PBF 30.7. So he is complaining of his tummy fat. Young male, doesn't have much of a sag. So what would you all want to do? Body contouring for just the fat. So in men, generally, especially younger men, you don't have to worry too much. It is in women post-delivery where you will have to worry about either a hernia or a excess divarication and all those things. And of course, as good physicians, it is our job to tell them whenever there is localized fat, irrespective of BMI, that body contouring is most efficiently done by liposuction. But our people are not quite ready for it most of the time. But if somebody has got excess fat, like that 44 BMI guy, he's got fat everywhere. If you have localized fat, then liposuction is ideal. If you have fat everywhere, then bariatric surgery is ideal, or a beyond weight loss program is ideal.
21 years female.
Next you have a 21-year-old female. BMI 39.7. PBF 52.8. Anyone from this table, these three ladies here? Kalpana, Swati and whoever? Sujata. Beyond weight loss. I'm impressed. Nobody is saying bariatric. But yes, so you can certainly, obviously you can't put her into the body contouring thing. Please do put her in beyond weight loss and simultaneously send her for a bariatric consult as well. So it is not like people who need bariatric surgery don't need diet consult. They need more than the others. Because bariatric surgery most commonly is done by something called a gastric sleeve, where the stomach is just shrunk. But you can cheat by eating high density, high calorie foods. So high calorie foods like chocolates, desserts, alcohol, because liquid will go in. So I once had a patient who came with acanthosis nigricans of the face. And then I told him, so he was 120 kg, barely my height, BMI 40 plus. So I said, I was hesitating, it was the first time. So I said, see, whatever I do, it's not going to really make a great deal of difference. And you should consider bariatric surgery. Very gently I said. Then he said, doctor, I already had bariatric surgery. Then I was like, shocked. So then I was like, oh, so who did? No, that is like our first instinct, which is not the right thing to do. Then he said, no, it's not the doctor's fault. So this person lost weight from 120 kg to 78. But then he started cheating on his meals and he started drinking, and then he went back to 120, and he did not have the face to go and meet the bariatric surgeon. He was ashamed to. Okay. So, which is what happens with this obesity, because there is a lot of shame associated with this whole thing, So that is why whenever you're talking about these, please be very empathetic, be very kind, because some casual word that you and I might say might hurt that person because they're already very, very vulnerable. So one last case scenario and then we move on to Mrinal's. 29-year-old male. BMI 23.3. I'm going to ask one of those people at CRT. Nobody is exempt. Okay. So BMI 23.3. Question for you all. And percentage body fat is?
5.1.
Hold your breath. 5.1. He is a 28-year-old male. If a woman had that, I would have had a heart attack. Yes, please. So these are real case scenarios. I hope you know that. All courtesy are nutritionists across the chain. So this person is not happy with his abdomen. His body fat percentage is 5.1. His BMI is 23.3. So you can imagine that his skeletal muscle mass is pretty good. So he's got a kind of a D. You remember the D thing that I spoke about? It's an exaggerated D. So what do you think we can offer him? He wants toned abdomen. Exercise. You think without exercise you can get to 5.1? That guy should be teaching you and me how to exercise. Only RF? So he's a 28-year-old. So it is possible that he has SAG. Excellent. So it is possible that he lost a lot of weight. Maybe he was 100 kgs and now he's lost some 30 kgs and he's come to wherever he is. So you might want to understand if there is SAG. So once you inspect, or once the dermatologist inspects, how do you inspect? You have to make him undress and then see and then palpate. And so if there is SAG, then go ahead and do the RF protocol, do a preheating for around 4-5 minutes till you get to some 38 degree with your infrared thermometer, and then do the tightening. But what if he doesn't have SAG? Then we tell him to wait for our high fem. So these are our rare, we have 1 or 2 of those across the clinic chain. So not too many of them. So I remember one patient of mine whom I was treating for severe urticaria. This was in my clinic. So I had to give him cyclosporin and all that. Then anyway, he responded well. And then we went on into various other things, including tear trough filler. Then, that's how this relationship begins. And then one day suddenly he asked me that, do you think you can help me with this? I have some skin excess, he said. He's a very aware man. Then I was surprised because in his clothes he seemed perfectly fit. And then he said that it seems he was 105 kgs and now he weighs around 78, 80. And then that was the time when we were launching body contouring program. So I said, yeah, soon next month we're going to have this. And then I brought him to Gachibowli because I was going to Gachibowli once a week during those time. And that time Purnima was around. And so I told Purnima that I have called this particular client for his first session. And his percentage body fat will be some 10-12%. It will be, let me know once it's done. So then she came running to me. And this was a 45-year-old gentleman. He's not an actor. He has his own software firm worth some 1,000 crores. So, busy guy. And his percentage body fat was 8.1%. So Purnima came running. And then she's like, because she'd never seen that kind of a number. I had seen it twice in my life, but not in 40 plus people. So I'd seen it in young actor aspirants, who spend 3 hours in the gym. This man is a busy man and he has over, I don't know how many employees and all, but still he managed that. So basically setting goals for all of us. Nothing more than that. So we did 4 sessions of Viara for him. Fantastic results. I think somewhere in our, our problem with body contouring is that we have too many pre-posts. So we don't know which one is because we can't identify, unfortunately. So somewhere if I can fish it out, I'll share it in the ACAD group. So 4 sessions and then so it was a fantastic result. So this was one such. So any questions about body composition? Please feel free. No questions as expected. So can I ask some questions? So I will ask just one question. So what happens when somebody is come for a 3rd, 4th body contouring session and their weight is not increased, but their fat is increased? Have you all experienced this kind of a situation, any of the nutritionists? Yes. So would you please share that experience with us? I'm sorry, I don't know your names. The lady in maroon.
So once when we get their detail that how you followed the diet and all, and they said that from the past 1 week or from 3 to 4 days, we did not follow the diet and there was no physical activity. So that's the reason why there is an increase in the percentage body fat, and simultaneously there would be decrease in the skeletal muscle mass also. So then we'll be aligning them that whenever you are going ahead with this thing and there is a decrease in your skeletal muscle mass, there is a protein thermogenesis that we say. If you are not increasing your protein, definitely there would be the increase in your percentage body fat. That's how the fluctuation happens. And when you are coming for the next session, you'll have to be aware that whenever you are having a cheat meal or you're not doing the exercise, you'll have to work on that particular area. It is causing you the increase in your percentage body fat.
Okay.
What I understood is that initially people are not very adherent to the regimens that we are giving, but as the sessions progress, you see less and less of this, Kaushik? Is that how it is? So that's what I understood at least, because eventually we are getting results. So initially, you might want to align your clients. So one more important task for today is result alignment. So we are saying that we will be able to give them localized fat loss, inch loss, which is evident not so much in the pictures, but on the inch tape. So fat loss is evident on the inch tape and sag is evident in the pictures. And most of the clients have both, so which means you will see a difference in inches also and in photographs also, provided they're taken reasonably well. So you will have to tell them that even if your weight stays the same, but the body composition changes, but because fat is going to occupy more space than muscle. So you will have to make them aware that even if the weight is the same, percentage body fat increase means results will not happen. So you might want to take a decision. See, if it's just a little bit, it doesn't matter. If it is significant, you might say you want to hold on. Let's not waste today's session. You come back after 2 weeks, after you at least go back to previous level. Has anyone had that situation in the clinic? Dr. Madhvi, yes. Would you just quickly tell us about that?
One client was undergoing BC, so after till 3-4 sessions she was fine, but after 3-4 sessions she had some events in the family and all, so there was a little increase in the weight and the percentage body fat. So what we did is we just asked her to hold on for 2 weeks. Okay, she just came back to her original diet, whatever we have advised, and we started again.
So this is not failure. This is a temporary pause.